sugar. They say I have sugar. They say those types of things. Well, what does that mean? Normally, the more common scenario in diabetes is going to be an insulin resistance. And insulin resistance, meaning your cells don't respond as well to insulin as they used to. Each one of your cells, your insulin is like a key to the door. And then once the insulin opens the door, then the sugar can come in and give the cell some nutrients. So that's why when we say insulin resistant, the cell, the key doesn't work as well. You got to juggle it around. You got to shake it to try to get the door open. Then you can let the sugars in. And that's kind of the underlining reason behind type 2 diabetes. Now, type 1 diabetes, the pancreas is not putting out enough insulin in the first place. And so you have to give that person insulin from the very beginning. In type 2 diabetes, you many times will go years on what we call oral hypoglycemics, which would be pills. And then eventually you have to get put on insulin if it lasts long enough, or if your sugars are not under very good control, or if you're starting to have diabetic complications such as neuropathies. Neuropathy is when you have pain sensation, numbness, tingling in maybe your arms, your hands and your feet. Those are common places where we get neuropathies in diabetic patients. Other common long-term side effects would be your vision begins to go down, and that's obviously a significant problem if your vision is going down, and lots of other associated problems. Probably those are probably the biggest two. No, the biggest three. And then the next big three would be the circulation. People with diabetes often end up with amputations of their extremities. And that's because of the circulation issue. So what happens with the circulation is the blood gets down to the foot, but it gets down to the foot, but it can't get out to the skin. And so it's like having a major thoroughfare that can get you into the city, but you don't have the side streets to get you down to the building you need to get to.
Okay.
And that's kind of what happens with neuropathy, with the vascular problems in diabetics. Many times they have an okay pulse, but the blood vessels are not making it to the skin.
Okay.
And then when you add things like smoking and obesity, then that makes the problem even worse. So smoking causes an acceleration in what we call atherosclerosis, which is hardening of the arteries. So an acceleration of a difficulty getting the blood flow out in the extremities, which would happen with cigarettes. So the longer a person smokes, the more challenges they have. Smoking is probably has more problems associated with it than any other negative thing we probably take into our body. Smoking, if we could get rid of smoking and just completely eliminate it, we could probably cut our health budget in half, because so many of the things that we experience are related to smoking, whether it be diabetes, hypertension, whether it be heart disease, lung disease, whether it be stomach cancer, colon cancer, whether you name it, it probably will have some association with smoking, some things more than others. But most things are going to have some association with smoking.
Well, it's safe to say any foreign object that you put into the body could have detrimental repercussions.
Well, possibly. I mean, I don't know if we want to be that global, that broad to say any foreign body bring to your body will have negative, but smoking is definitely one of those negatives.
Definitely one of the negatives.
Right. I mean, you definitely can bring some things into your body that are foreign that can be positive, but smoking is not one of them.
Okay.
Smoking, we talk about alcohol, we talk about drugs. We don't talk a lot about the multiple complications that smoking causes. People hear about lung cancer, they hear about throat cancer. They don't go, the average person doesn't go much beyond that in their understanding of the complications and problems that smoking causes.
That's correct.
And the list is endless. I tell you, smoking is associated with more medical problems probably than any other single negative thing that we can take into our body. Way more than alcohol and drugs. Way more than those. Obviously, they have their problems too, so I'm not suggesting that those are good. I'm just suggesting that smoking is worse.
Smoking is worse.
So, so again, a little brief summary on diabetes. I know I had several questions on Alzheimer's disease, and I was going to try to get to that topic today because, yeah, that's a pretty big issue as well. And Had a lot of patients have been asking me those questions here lately. And those of you who are joining us on the World Wide Web, want to again say welcome to you. Those of you on the radio that want to join us on the World Wide Web, go to my website, askdrferguson, Ferguson.com. The middle of the page, you'll see a link that says live radio. Click on that, and that will take you to the YouTube site. On the YouTube site, in the top left-hand corner, there'll be a little house. Click on the house, and then click on feed, and then you'll be able to join us live on the YouTube, and you'll be able to not only hear us but see us. If you do that, turn off your radio because you'll get a feedback. There's about a 30-second delay for the YouTube. And we're always happy to have you join us, whether it's on the radio or whether you join us live. And our audience live has been growing, because when you say World Wide Web, people often forget that is the World Wide Web. It's people from throughout the world can join you and listen and partake in what you're doing. You know, many of the scriptures in the Bible, they often figured out how would it ever be fulfilled. You know, one of the prophecies was that people will be lying dead in the streets in Jerusalem, and people all over the world will see them simultaneously. Well, you know, it wasn't until the past, I don't know how long satellite's been out, 20, 30 years, 40 years. It wasn't until that time that was possible. That, you know, you could see somebody lying in the street dead in Jerusalem, and you could see them all over the world simultaneously. And you can imagine what somebody in the 18th century would have thought about such a statement. You know, they said impossible. No way could that happen. You know, but now we know that can very easily happen. And that happens daily, constantly. You pick up the telephone, you can talk to anybody in the world, you go on the internet, you can interact with anybody in the world, and instantaneously. You know, they can connect up, and without even a delay, you're talking to somebody across the world. So I want to welcome all of you that are joining us on the World Wide Web, and those of you locally who want to join us there, that's what you're welcome to do that as well. So, and again, those of you who have questions for us and like us to have different topics, you can always call my office at 252-332-6484. You can let them know you have a question, or you have something you want me to talk about on the air, or you can set up an appointment to see us. All of those work just fine. And then my website has a lot of nutritional and tips on there, and that's askdrferguson.com. A lot of good things on there. And my YouTube site at youtube.com/user/askdrferguson. Then I have a lot of YouTubes on Alzheimer's disease, substance abuse, what else? Natural hormone therapy. I have also what I call the Passion Cam. And the Passion Cam is where I put my video camera on my dashboard, and I just talk while I'm driving about some topic that I'm passionate about. So those are all good resources as well for some of you who want to gain more information and some preventive healthcare things. So back to diabetes for just a little bit here. There are some things that make a person more likely to get diabetes, and there's 5 of them. And let's see if I can remember off the top of my head. They're referred to as I can't even think of what the heading on them is. But one is a waist size for women greater than 35, for men greater than 40. That's one of the risk factors. Cholesterol, an HDL cholesterol, which is your good cholesterol, I think less than 40. Now, I'm kind of guessing at this, so don't take it. Don't be absolute on these. But a cholesterol, HDL, your good cholesterol that's not as high as it should be, that's another one of the risk factors. Boy, I thought I could come up with these off the top of my head, and I'm blanking. One of them was a fasting blood sugar. Fasting blood sugar of I'm blanking on them. So we'll tell you those next time because I'm not remembering them. But there's 5 characteristics. If you have 3 of those 5, then your likelihood of coming down with diabetes is pretty high. Now, what it just says, I'm kind of skipping around a little bit here. If you're significantly overweight, or if your diet's significantly out of whack, by losing weight and changing your diet around, many times you can have a very dramatic effect on your blood sugars. The other thing that can give a dramatic effect on your blood sugars is losing 10% of your body weight. So if you weigh 200 pounds and you lose 10% of your body weight, that's 20 pounds. That can have a dramatic effect on both your blood sugars and your blood pressure and how you feel in general. So just don't forget, I have patients come in the office all the time and they say, Doc, I lost 2 pounds. I said, I'm not giving you no brownie points for 2 pounds. And they say, Doc, I'm really trying. I said, no, you're not. You've been weighing the same thing for the past 3 years. That doesn't tell me you're trying. And so in the early on, I used to really do a lot with weight loss and weight management, and my success level was just so low because I felt that I was being a great cheerleader, but people weren't playing the game right. They weren't doing the things they need to do. Weight loss, weight management, it can be challenging because it takes you out of your comfort zone. You're doing something that you may not feel so great, may make you tired, may give you a little shortness of breath. Hard work is often not the thought that person wants to do when they're thinking about doing exercise. And so that's, I think, one of the reasons why a lot of people don't do the exercise, because it's hard. And that's anything in life you're going to be successful at or that's going to be worthwhile, it's going to take some energy.
Yes, sir. No pain, no gain.
Well, yeah, it's going to take some work to get there. And so I encourage those of you who have issues with diabetes, hypertension, weight in general. Weight loss can be a very valuable tool in helping you feel better and helping decrease the amount of medical problems you have in general. Weight loss can be very, very valuable in that setting. So I encourage you to start a regimen and keep the regimen. I don't matter how fast you go. I don't matter how much you're doing initially, but to be consistent is the key. And make it important. You gotta set a time for it. Okay, Thursday at 2 o'clock, I'm gonna do my exercise. Nope, can't go to town. Nope, can't take it here. Nope, not gonna do that. That's my exercise time. Make it important. The things we write down and put times and dates on them, those things are usually more important to us than the things we don't.
Okay.
And so I encourage those of you who are going to try to develop an exercise regimen that you make it important. Try to do it 3 to 5 times a week, something where you're going to get your heart rate up and keep it up for at least 20 minutes. And then proceed from, increasing the numbers after that. If you're more elderly and you really can't get into a good exercise regimen because of your limitations for arthritis or difficulty moving, etc., then do your exercises in the chair. If you say, I got even more limitations, then do your exercises in the bed. The key is everybody can do something. And if you set your mind and then set your scope on doing something that's going to help you in maintaining your weight or losing the weight or maintaining your muscle strength, then I think you're going to be much better. But you have to make a decision that you're going to do something. So many times I'll have patients in the office that say, oh, I tried everything, Doc. Well, they've lost already.
Okay.
Anytime a person can think they've tried everything, they've already lost. Because you could have never possibly tried everything. And then when you start digging into the folks that say they've tried everything, you begin to evaluate their food, their food diary, their sleeping habits, their eating habits, how much water they're drinking, what kind of stress they're under. You often find there's tons and tons of holes in that little equation. I think one of the most common ones, excuse me for yarning there, I think one of the most common ones I find when people are telling me they've tried everything is that they're eating 1 meal a day. Well, that's a ticket for weight gain. And people don't often understand, how are you going to gain weight if you only eat 1 meal a day? Because your body develops a new steady state once you've done that for 3 to 6 weeks.
That's amazing.
Huh?
That is amazing. I would have never thought that.
Right. Well, and what happens is your body needs nutrients to function. And every 2.5 to 3 hours, if your body doesn't get the nutrients it needs, it begins to shut down. It starts heading towards a starvation state. And so what does that mean? That means your body is trying to maximize the utilization of the energy that you have given it, that you've exposed it to. And so it doesn't know when it's going to eat again, doesn't know when it's going to get more energy. So it starts conserving what you've given it. And over a period, when you initially, the first 1 to 3 weeks, you'll lose weight when you go down to 1 meal a day. But then your body develops a new steady state. That's your metabolism. And that's how fast you're breaking down and utilizing your food. That's what we call metabolism. So as you begin to skip meals, your metabolism goes down. So now, after say 6 weeks, 4 to 6 weeks, now maybe you used to burn 1,800 calories a day. Maybe now you're only burning 1,500 calories a day. So now you're burning 300 calories less than you used to burn. And now you eat the way you used to eat. Well, what's going to happen? Well, you're going to gain weight because now you're bringing in another 300 extra calories a day that you were burning off before you decided to not eat but one meal a day.
Wow.
And this is a very, very common challenge and problem associated with patients that are having problems with weight. One of the next most common issues is lack of water. Women, 55% water, men, 65% water. If you're not drinking water, you're out of balance. So lack of water in your regular regimen, your regular diet is a major problem. Your water is the most important nutrient that you can take in. You got more water in you than you have anything else. And if you don't drink any, what do you think that makes you? Out of balance. And once you get out of balance runs like a cascade. It runs to the next problem, the next problem, next thing you got a hormone problem, then you got a joint problem, then you got a heart problem, then you got a diabetic problem. And out of balance just cycles. It goes around and around and around. She goes, and where she stops, nobody knows. So balance is so critically important when you're talking about overall good nutrition, when you're talking about eating healthy, sleeping healthy, controlling diabetes, controlling hypertension, or not getting it in the first place. All of those things can occur by balance. Now, I'm not speaking of the genetic component, because there's a genetic component to a lot of things. There's one to hypertension, there's one to diabetes. But most in the Western society that I found that I'm working with, most of their problems is usually, I don't know, it's hard when you start saying always, usually, those kind of words, but let's use a lot. A lot of their medical problems with diabetes and hypertension is coming from environment. Nothing to do with genetics, but it has to do with what they're eating or not eating, how they're exercising or not exercising. So those are the things we refer to as environmental. And many of the challenges that a person in the Western world faces is secondary to their eating habits, their exercise habits, and things like that. So that's real important to kind of put it in the back of your head, to understand that in all that getting, you got to get an understanding. So if weight loss is your issue, skipping meals is the worst that you can possibly do.
Wow.
And so those are two big fallacies that I get when patients are telling me they've tried everything. One is they haven't come near to trying everything, and they're skipping meals. And two is they're not drinking nearly enough water. So those are two common characteristics. I'm sure there's many more common characteristics of a person that's having an issue with their weight, but that's one of them or two of them. Well, we'll talk about that again on another program. So back to diabetes. Many times, some of you may have known your doctor draws a blood work called a hemoglobin A1C. But that's a reflection of your blood sugar over the past 3 months. So what that says when we get those results back, it says that over the past 3 months, your blood sugars have been averaging X. Now, the 6 is equivalent to a blood sugar of 120. 7 is equivalent to a blood sugar, and I'm talking about hemoglobin A1C. So if your hemoglobin A1C is 6, that's equivalent to a blood sugar that you're averaging about 120. If your hemoglobin A1C is 7, that says you're averaging about 150, and I'm going up 30 each time. If it's 180, that says your blood sugars are averaging 8. If it's 210, that means your blood sugars are averaging 9. So you can see that's what the hemoglobin A1C is for. So I'm sure many of you seen it, maybe didn't know what it was for, how it was utilized, but that's how it's utilized. How many nutrients? Well, that's how it's utilized. So I'll stop at that when we speak of that. So there's so many components there that one needs to look at if they're going to have healthy living. And I always tell people to look at the whole pie. When you look at the whole pie, you got many components. You got water, you got sleep, you got exercise, you got identifying and working with your stress, you got managing chronic problems. All of those things are part of the pie. And you have to get all those things in order if you're going to have success. You can't just do one part. You got to do all of those parts. Does that make sense?
Okay.
I'm saying, does that make sense?
Makes sense to me.
Yeah, that's you just can't do one thing. This is the same thing I say in so many different categories in my office. When I have a person comes into my substance abuse clinic, I make it very clear to them that they got to work on all the parts at the same time. They can't just go on and get clean and get off their narcotics and then decide to begin working on some of the other challenges they're having in life. They have to be working on them simultaneously.
Okay.
And that means diet, exercise, good nutrition, good sleeping, identifying your stresses, where they at, what am I doing about them, how am I managing them. All of those things become very critically important. So again, those of you who want to get more information, I have a lot of information on the website at AskDrFerguson.com, at YouTube site, youtube.com/user/AskDrFerguson. Tons of videos on lots of different things. There's multiple places. If you forget any of these things I've been saying, you can just go to the Google search window and type in Ask Dr. Ferguson, or type in Stephen Ferguson or Stephen Ferguson MD. Any of those will take you to multiple places where I have a presence on the internet. But I think the most valuable ones to our listening audience are going to be the ones at YouTube and the ones at AskDrFerguson.com. Because there's just a wealth of information there. And all the information is designed for the individual to utilize it immediately. That's what it's designed for. But it's always good to check with your healthcare provider before you start anything new. I would definitely encourage that's a good thing to do, to check with your healthcare provider before you decide to do anything. Getting all that, get an understanding. And so beginning to read more about diet, exercise, lifestyle changes. What does it mean? How do I do it? What should I be doing? All of those things become critically important if you're going to be on a track to success. You don't wait to the end to try to correct some things, but start now and correct them all along the way.
Okay.
So that's just a little tidbit there that should be helpful to some of those that are listening on this. But back to diabetes as we close out today. Don't have much time left. When you talk about diabetes, many times people, one of the first things they think about is taking an insulin shot. Well, the vast majority of people are probably not on an insulin shot. There are lots of oral hypoglycemic medication we have now, meaning medicine you take by mouth, that can be very effective for diabetes. So for those of you who have been shying away from going to the doctor's office or not going to the doctor's office because you're afraid what they're going to tell you and you don't want to go on insulin, then again, there's some substitutes, but you first got to get diagnosed and get checked out. So many times we don't do things because we think it's going to cost so much. And then we do it and said, oh, it wasn't bad at all.
Right.
Yeah. So don't let that stop you from doing the things you need to do and the things you need to do to be healthy. And those of you who want to see us in the office, you can always call at 252-332-6484, make an appointment to see us. And if you do that, make sure I give you a copy of my lifestyle changing sheet, which is just some basic tips I've put together that I think everybody should utilize on a daily basis.
Could we also get that off of the web?
I don't have it on the website. It's a paper I put together that I hand out in the office. Although, the information is by no means exclusive to me. I just put it together in a little package that I give the patients, and I call it my lifestyle changes. I don't think I have it on my website. If it is on my website, I must have put it there a long, long time ago, because I actually started utilizing the website, I think 1980, 89 maybe. So it's been a good little while.
5 years.
For when I started using the internet for different teaching tools and things like that. So those of you who do have diabetes, learn as much as you can about it. All that getting understanding. The more you understand about your diabetes, the better you're going to take care of it. Diabetes and hypertension often run together, along with high cholesterol. And if you add obesity to the equation, then then there's a high probability that those things are going to all come together.
Almost a certainty.
The high cholesterol, the high blood, the diabetes, lots of times are overweight, lots of times not drinking enough water, not drinking enough fruits and vegetables. All of those are a combination that will probably drive the person into a category of having diabetes. When you talk about diabetes, there's what we call a glycemic index. So that's what I want you all that are listening to look up. Look up glycemic index. Now, that's going to tell you some different foods, and it tells you how the body can utilize the sugar that's in that food and how it breaks down. So I think that's a very important site to look at and to put together your own profile of the medicines you want and medicines you don't want. And when you put together that profile, then that's going to help. Whenever you put together a profile, that's going to help you move forward, with success. Because I always tell people you need a roadmap. If you're going to go from here to Philadelphia, you don't just jump in your car. You get the plan together. How are you going to get there? You have a GPS, you got a map, do you have enough money? You're going to stay at the hotel, you're going to stay at someone's house. Are you going to need money for tolls? All of those things are important before you jump on the road and take a trip.
That's correct.
And the same thing, it's important that if you're going to have success in preventive health, you got to set a foundation. You got to set the parameters. And that's important. But the glycemic index, for those of you who want to look it up, it lists a whole bunch of foods that are better for you as far as diabetes is concerned than others. And one of those things on that list is chocolate cake. And why is that? Because the cocoa has an antioxidant component to it.
Wow.
An antioxidant is a cancer fighting. It could be cold fighting. It could just be disease fighting in general. But the antioxidants are a police force in your body that help bring free radicals, which is a cell functioning abnormal, back into check. And that's what they do. That's their whole sole purpose, is to police the place.
Okay.
All right. So any questions you had quickly as we come to an end here for today?
Well, you spoke on nutrients. Can you give us a real brief definition of nutrients?
Nutrients are those things you take into your body that are going to give your cells energy. You have proteins, you have fats, you have carbohydrates. Those are your sources of nutrients. For every gram of, I'm trying to think which is which. Protein is 9 grams, 9 calories per gram, and carbohydrates, proteins, fats, sugars. The fats and the carbohydrates, which would be your sugars, I think they are 4 calories per gram. So that means if you're going to eat something that has, fats, proteins, and carbohydrates in it, then that's the amount of nutrients. That's the amount of calories you're going to get from there. They're not synonymous, nutrients and calories, but I use the kind of synonymous there. And nutrients are those things, those foods you take into your body, and then you break it down. Your body breaks it down into such a way that you can now utilize it. And that will be, simple sugars, amino acids, proteins break down to amino acids, fats break down to simple fats, fatty acids that your body can then utilize. And so that's your nutrients. Your nutrients is what keeps you alive.
Okay, well, Doc.
All right. So on that note, to our listening audience locally and to our listening audience internationally, thank you for joining us. Tell your friends about us. Come back and see us next week, every week, 9:30 to 10, coming out of Ahoskie, North Carolina. And be blessed and just have a wonderful day.
And thank you very much, Doctor.
All right. Bye-bye now. And those of you on the World Wide Web, sorry that may have been just a little jumble today. I hope it came through well because the reception has been a challenge for us here. And I'm broadcasting from the Down East Nursing Home, one of the nursing homes where I see patients. And I just hope that comes through for you. But don't forget to ask your friends to join us as well. Every Wednesday, 9:30 to 10. You come right here. We'll catch us on this Google page. Those of you who also, if you become sign up and you become a subscriber, then I think you'll automatically just get an email that we're getting ready to do my live program. So ask others to join us, and we enjoy having you, and just providing some good preventive health information is our goal. So on that note, be blessed and have a wonderful day. Bye-bye.